Hi, I'm Dr. Sajit Nair. I am a general surgeon and a laparoscopic and a laser proctology surgeon. Today I would like to speak to you about fistula. What is fistula? Or fistula in anal as we call it. Fistula, basically we have anal glands around 3 centimeters inside from the anal verge. Those anal glands get infected. Now why do they get infected? Anybody can get infection. Plus it's not a very clean area. The fecal matter always keeps passing down from there. So the infection here is what happens is the infection spreads to the surrounding areas. So people present with two ways. Either they can present with an abscess, which presents as swelling and pain and redness in the nearby area of the anal orifice. Now the patient when presents like that, either we drain the abscess or sometimes the patients wait or take antibiotics and it opens up like an opening outside close to the anal verge with a lot of pus or bloody discharge. Once the pus comes out, the patient is usually comfortable for some time along with antibiotics, and it settles for some short period of time. Then what remains there is actually like a bypass road that has one connection inside to the anal canal, one opening inside and one opening outside to the outer skin close to the anal verge. This is what we call as fistula. It's like a bypass road that again and again is prone for infection because the fecal matter is coming from there and the bacteria will infect the tract. Again there will be a swelling. Patients usually present with small swellings or continuous discharge from that external opening. Most commonly this is a ignored condition, mainly because it's diagnosed late. Patient keeps going to regular physicians who probably diagnose it as some kind of a small pimple or mild infection which subsides with antibiotics, and hence it is quite late diagnosed. There are different types of fistulas. One is a low anal fistula, one is a high anal fistula, simple fistula, complex fistula. They have some have multiple external openings, some have multiple internal openings. Now how do we diagnose fistula? Fistula is usually a clinical diagnosis, but to confirm we do a TRUS, which is a transrectal ultrasound, or an MRI. Both of them are quite effective in diagnosis of fistula. Why do we need to do these scans? That is to know where exactly is the internal opening, how many internal openings are there, at which level do they open, or how the tract is traveling. So this gives us a fair idea how we proceed with the treatment. Early diagnosis is the key for a good treatment and early recovery. Since there is an internal opening of the fistula, it is prone for recurrent infections. Patients may present with recurrent infections, some blebs, or can turn up present with abscess altogether again. Every time there is an infection, there are chances that the fistula becomes complex. So many of them present to us in a complicated state, which then the treatment and the recovery stage prolongs. Here at Pristyn Care, we are treating it with laser. Now we use the diode laser, and which is the latest all over the world which we use. Traditionally, the fistula is treated by laying the tract open or excising the whole tract. But here we use the laser. What we do is the laser is passed through the external opening and it ablates the tract. It's usually a one-day procedure, and unlike the traditional procedure, there is no large wound which needs to be dressed and which heals around 2 months. It takes around 2 months to heal. In laser, there is no large wound. A simple dressing which can be done by the patient themselves at home, review once in a week, and they can be functional within 3 or 4 days at their regular routine job.